You wake up, reach for your glass of water, and realize your mouth feels like it has been left out in the desert overnight. Your tongue feels stuck, your throat feels dry. Maybe your mouth is so dry that talking in the morning takes a few extra seconds. And if this happens every day, you may have already convinced yourself that it is just another one of those things that comes with getting older. But here's the part I want you to remember. Persistent dry mouth is not something you should automatically blame on age. In fact, the National Institute of Dental and Craniofacial Research specifically says dry mouth is not a normal part of aging. And in older adults, it can be caused by medications, medical conditions, problems with the salivary glands, or several of these factors at the same time. So if you wake up with a dry mouth every morning, don't panic. But don't ignore it either, because saliva is doing much more than keeping your mouth comfortable. It helps you chew, it helps you swallow, it protects your teeth, it helps control the germs living in your mouth. And when saliva production drops for weeks or months, problems can start showing up in places you might never connect to your mouth. Your appetite, your teeth, your gums, your ability to swallow. And in some older adults, even your risk of respiratory infections. And there's another reason I want you to stay with me. Sometimes the dry mouth itself isn't the problem. Sometimes it's the clue. It can be the little signal that makes you ask the right question about a medication, blood sugar, sleep apnea, an autoimmune condition, or another health issue that deserves attention. And later, I'm going to show you a simple morning check you can use to describe your symptoms more clearly to your doctor or dentist. But first, you need to understand what saliva is actually doing for you. Because once you understand that, dry mouth stops looking like a minor inconvenience. It starts looking like information. I'm Dr. Roberto, and on this channel, I take the research that has changed and put it in plain language for people over 60. If you want more simple, science-based health information that could help you protect your health as you get older, please like this video and subscribe to the channel. Now, think about Mary. Mary was 69, retired, independent, and very careful about her health. For nearly 2 years, she woke up with the same problem, a painfully dry mouth. She kept water beside her bed and took a few sips as soon as she woke up. The water helped for a little while, then the dryness returned. She mentioned it during a routine appointment, and the explanation she heard was familiar. You're getting older, try drinking more water. So she did, but the problem continued. And over time, other things started changing. Food didn't taste quite as good. Some foods became harder to chew. She started preferring softer meals. Her weight slowly dropped. And she began having repeated respiratory infections. None of these problems seemed connected, at least not at first, but they were all part of a bigger picture. And the first piece of that picture is saliva itself. Your salivary glands are constantly producing fluid that does several important jobs at once. Saliva moistens food and helps you chew and swallow. It helps wash food particles away from your teeth. It contains minerals that help protect tooth enamel, and it contains substances that help keep harmful microorganisms in check. So when saliva disappears, you don't simply lose moisture, you lose protection. And the first place that can matter is your airway. Now, I want to be careful here. I'm not telling you that every person with dry mouth is going to develop pneumonia. That's not true. But oral health and respiratory health are more connected than most people realize, particularly in older adults who have swallowing problems or are vulnerable to aspiration. Aspiration simply means material from your mouth or throat enters the airway instead of going down the esophagus. Tiny aspiration events can happen without you noticing. And when oral bacteria are present in the material that enters the airway, they can contribute to respiratory infections in vulnerable people. That is one reason oral hygiene matters so much as we get older. A dry mouth can make this situation more difficult because saliva normally helps keep the mouth clean and supports a healthier oral environment. So if you already have swallowing problems, frequent respiratory infections, or difficulty clearing mucus, persistent dry mouth is worth mentioning to your doctor and dentist. Mary eventually realized something else. Eating had become work. Think about eating a dry piece of chicken when your mouth doesn't produce enough saliva. You chew again. The food doesn't form into an easy-to-swallow bite. You need water just to get it down. Now imagine that happening every day. Suddenly, foods you used to enjoy aren't as appealing. Bread feels too dry, meat feels difficult, crackers are almost impossible, raw vegetables aren't as comfortable, and you may start choosing foods based on one question: what can I swallow easily? Not, what gives my body the nutrition it needs. That's an important distinction. Dry mouth can interfere with chewing, swallowing, tasting, and eating comfortably. And if those problems continue, some older adults may eat less or avoid certain nutritious foods. So you can end up with a strange situation. You're still eating 3 meals a day, but your diet may be getting smaller, softer, and less varied. And if you've been losing weight without trying, don't automatically assume it's simply because you're getting older. Tell your doctor, tell your dentist, and tell them if you also have persistent dry mouth. That combination matters. Now let's talk about the place most people notice first, your teeth. Saliva is part of your mouth's natural defense system. It helps clear food debris and provides minerals that help protect your enamel. When saliva production falls, the risk of tooth decay can increase. And this can happen even if you've been brushing faithfully for decades. That's one reason a person can suddenly start having dental problems after years of relatively healthy teeth. They may think, what changed? I brush just like I always have. Sometimes the answer is that the mouth itself changed, and dry mouth may be part of the reason. You can also develop irritation, mouth sores, bad breath, difficulty wearing dentures, and fungal infections such as oral thrush. So if your dentist suddenly tells you that your mouth is unusually dry, don't just treat the dental symptoms and move on. Ask why, because the biggest question is not, how do I make my mouth feel wetter? The bigger question is, why did my saliva decrease in the first place? And for many older adults, one of the first places to look is not the kitchen. It's the medicine cabinet. This is where things get interesting. Hundreds of medications can contribute to dry mouth. Some blood pressure medications can do it, some antidepressants can do it, some antihistamines can do it, some bladder control medications can do it. Some medications used for sleep, anxiety, pain, or other conditions can also contribute. And if you're taking several medications, the effects can add up. This is especially important with medications that have anticholinergic effects. You don't need to memorize that word, but you should know what it means. Anticholinergic medications can interfere with the chemical signals that activate certain body functions, including saliva production. And the problem is that older adults are more likely to take multiple medications. So you may have one medication that causes a little dryness, another that causes a little more, and another that adds to the effect. Individually, none of them seems like the obvious culprit. Together, they can become a very different story. That's why I want you to do something very practical. Don't look at only the newest medication. Look at the entire list. Prescription medications, over-the-counter medications, allergy pills, sleep products, pain medications, bladder medications, everything. And don't stop anything on your own. Instead, bring the list to your doctor or pharmacist and ask, could any of my medications or the combination of them be contributing to my dry mouth? That's a much better question than simply asking for something to make your mouth wetter. Because if a medication is causing the problem, treating the cause may be more useful than constantly treating the symptom. And there's another clue you can watch for. The timing of your dry mouth can sometimes tell you what to investigate next. If your mouth is especially dry when you wake up, think about what happens while you're sleeping. Do you snore loudly? Do you wake up gasping? Do you wake with a headache? Do you feel exhausted even after what should have been a full night's sleep? Do you sleep with your mouth open? If so, talk with your doctor about whether sleep apnea or nighttime mouth breathing could be contributing. Don't diagnose yourself from dry mouth alone, but dry mouth plus loud snoring and daytime exhaustion is a combination worth discussing. Please do me a small favor and tap the subscribe button and give the video a like while you're there. It genuinely helps this reach more people who need it before the day they need it. And leave me a comment. Now here's another pattern. Suppose you're waking several times every night to urinate, and you're also unusually thirsty or experiencing persistent dry mouth. That doesn't automatically mean you have diabetes, but it is a good reason to ask whether your blood sugar should be checked. A simple blood test, such as an A1C, can help your doctor evaluate your average blood sugar levels over the previous few months. And here's another combination I don't want you to ignore. Dry mouth plus very dry, gritty eyes. If your eyes constantly feel as though there's sand in them, and your mouth feels dry even when you've been drinking enough fluids, tell your doctor. One possible cause is Sjogren's disease, an autoimmune condition that can affect the glands responsible for tears and saliva. It isn't the only possible explanation, but it is one worth considering when the symptoms appear together. And then there are changes in taste. A persistent, metallic, or unusual taste can have many possible causes, including medications, dental problems, infections, and other medical conditions. So don't jump to conclusions from one symptom. But if the change is persistent, especially when it appears alongside other new symptoms, tell your healthcare provider. Your mouth is giving you information. Your job isn't to diagnose yourself. Your job is to notice patterns and give your healthcare team better information. That's an important difference. And now we need to clear up one of the biggest myths about dry mouth. Just drink more water. Water is important. Please don't misunderstand me. Staying properly hydrated matters. But water and saliva are not the same thing. Saliva is more than water. It contains proteins, minerals, enzymes, and other substances that help lubricate your mouth, support swallowing, protect your teeth, and maintain a healthier oral environment. So when you drink water, you may feel better temporarily. But if your salivary glands aren't producing enough saliva, the water doesn't solve the underlying problem. That's why someone can drink glass after glass and still wake up with a painfully dry mouth the next morning. The answer isn't always more water. Sometimes the answer is finding out why the saliva isn't there. And this is also important if you wear dentures. You may think, I don't have my natural teeth anymore, so dry mouth shouldn't matter as much. Actually, your mouth still needs saliva. Dryness can contribute to irritation beneath dentures, difficulty keeping the mouth comfortable, problems with taste, and increased risk of oral infections. So whether you have all your natural teeth, a few teeth, or full dentures, persistent dry mouth deserves attention. Now let's go back to Mary. Remember, she had been told to drink more water. She did. But eventually, someone looked at the entire picture. The dry mouth, the appetite changes, the weight loss, the medications, and the recurring infections. Instead of treating each issue as a separate problem, her healthcare team reviewed her medication list and looked for possible contributors. Some medications were adjusted. One medication was no longer necessary and was discontinued under medical supervision. And slowly, things began to improve. Not overnight, not magically, but gradually. Her mouth became more comfortable. Eating became easier, her appetite improved, and she finally had an explanation for something that had been bothering her for years. That's the lesson I want you to take from her story. You don't need to be frightened by dry mouth. You need to pay attention to it. So what can you actually do? Let's make this practical. Tomorrow morning, before you immediately reach for that glass of water, pause for about 2 minutes. Notice what your mouth feels like. Is it mildly dry, extremely dry, sticky? Is your saliva thin and watery, or thick and stringy? Do you have trouble swallowing without drinking first? Do you have a strange taste, bad breath, a burning sensation, sore spots, white patches? Do your lips feel unusually dry? And most importantly, ask yourself, how long has this been happening? You don't need a complicated test. You're simply collecting information. Write it down for a few mornings. That gives your doctor or dentist something much more useful than, my mouth feels weird sometimes. You can say, I've been waking up with severe dry mouth every morning for 3 months. I have to drink water before I can swallow comfortably, and I also take these medications. That's a much better starting point. Next, do a medication review. Make one complete list. Don't leave out the over-the-counter products because you only take them occasionally. Take the list to your doctor or pharmacist. Then ask, could any of these medications be reducing my saliva, and is there a safer alternative if appropriate? If you're taking several medications, ask whether the combination could be contributing. And remember this, never stop a prescription medication simply because you heard it can cause dry mouth. Some medications protect your heart, some control blood pressure, some prevent serious complications. The right solution may be changing the dose, changing the medication, changing the timing, or simply treating the dry mouth while keeping the medication you need. That's a decision for you and your healthcare professional. Now let's talk about things you can do at home. Keep drinking water regularly. Take small sips during meals if chewing or swallowing is difficult. Sugar-free gum can help stimulate saliva production. Sugar-free lozenges can also help. Some products contain xylitol, which may provide additional dental benefits, but remember that too much xylitol can cause stomach upset in some people. For persistent symptoms, saliva substitutes, sprays, gels, or moisturizing products designed specifically for dry mouth may help. Ask your dentist or pharmacist which option makes sense for you, and pay attention to your mouthwash. If your regular mouthwash makes your mouth burn or feel even drier, ask your dentist whether an alcohol-free dry mouth rinse would be a better choice. Good oral hygiene becomes even more important when saliva is low. Brush your teeth with fluoride toothpaste. Clean between your teeth. Clean dentures properly if you wear them, and keep your regular dental appointments. Your dentist may notice the signs of dry mouth before anyone else does. You can also make meals easier. If food feels too dry, add moisture. Use sauces, broths, gravies, yogurt, or other foods that make chewing and swallowing more comfortable. Choose foods that provide real nutrition rather than simply choosing the softest processed foods. And remember, chewing itself can stimulate saliva. So if you can safely chew crunchy, water-rich foods such as cucumber or other vegetables, they can be useful for some people. But if you have swallowing difficulties, don't force yourself to eat foods that could increase your choking risk. In that situation, ask your doctor, dentist, or speech-language pathologist for individualized advice. At night, think about the air you're breathing. If your bedroom is very dry, a cool mist humidifier may make your mouth and throat feel more comfortable. Keep it clean and follow the manufacturer's instructions. And if you constantly sleep with your mouth open, don't simply accept that as normal. Ask why. Nasal congestion, allergies, mouth breathing, sleep apnea, the cause matters. Now, there are a few signs that deserve faster attention. If you have persistent white patches in your mouth that don't wipe away, get them checked. If you develop severe difficulty swallowing, significant mouth pain, swelling, or repeated infections, contact your healthcare provider. And if dry mouth appears with a serious symptom such as trouble breathing, chest pain, sudden confusion, fainting, severe weakness, or other signs of an emergency, seek emergency medical care. The point isn't to become afraid of every dry morning. The point is to know when a simple symptom has become persistent enough to deserve an explanation. And here's the bigger lesson. Your body doesn't always send you a dramatic warning. Sometimes the signal is subtle. A change in your appetite, a new medication side effect, a mouth that feels dry every morning, a sudden increase in cavities, food that doesn't taste right anymore, difficulty swallowing. You may think these are separate little annoyances. Sometimes they aren't, sometimes they're pieces of the same puzzle. And the good news is that many causes of dry mouth can be treated or managed. So don't simply accept persistent dry mouth as the price of getting older. Start with one simple question. Why is this happening? Look at your medications. Think about your sleep. Notice your other symptoms. Talk with your doctor, talk with your dentist, and pay attention to what your body is telling you. Because getting older should not mean becoming less curious about your health. It should mean becoming better at listening to it. And if you've been waking up with a dry mouth, here's what I want you to do tomorrow morning. Don't just reach for the water. Pause. Notice it. Write down what you're experiencing. Then start asking the right questions. That tiny habit could be the first step toward finding a problem you didn't know you had, or simply getting relief from something you've been putting up with for far too long. If this video helped you understand why persistent dry mouth deserves more attention, subscribe and stay with me. Because the goal isn't to worry about every symptom. It's to understand the signals that matter, catch problems earlier when possible, and protect the strength and independence you worked so hard to build. Take care of your mouth, take care of your body, and most importantly, don't dismiss a persistent change just because someone told you it's just aging. Sometimes the smallest signal is the one worth listening to.